Kaye. Today we will be discussing about the abnormalities of teeth. So, the environmental alterations of teeth are the developmental tooth defects, post-developmental structure tooth loss, discoloration of teeth, and localized disturbances in eruption. So for the factors, I will be placing them here, and the systemic and local factors here. So for the animal defects, matrix formation, mineralization, and maturation. So for the animal defects, animal hypoplasia occurs in the forms of pits, grooves, or larger areas of the missing animal. For diffuse opacities, variation in the translucency of animal thickness with white opacities and no boundary. For demarcated opacities, variation in the translucency of the animal, normal thickness with white opacities and clear boundary. So, this is a Turner's hypoplasia. It is caused by periapical inflammatory disease of the overlying deciduous tooth, most commonly noted in permanent bicuspids due to the overlying deciduous molars. So, this one is a molar incisor hypomineralization. The animal defects of one or more first permanent molars. The altered animal is white, yellow, or brown and often soft and porous. Affected teeth are sensitive to cold and warmth and animal chip off easily. Difficult to anesthetize during dental procedures. So this one is dental fluorosis. So the integration of excess amount of fluoride can also result in animal defects known as dental fluorosis. So the integration of fluoride into the animal reduces the incidence of caries. Pre-eruptive as well as post-eruptive supply of fluoride is equally effective. However, second and third decade is critical for application of fluoride. As you can see in the picture, it is the ones with marks, demarcations, and stuff. So this one is dental fluorosis. So it is a definitive diagnosis, requires bilateral presence of defects, evidence of prior fluoride intake, and elevated levels of fluoride in animal. The antibiotic administration during development reduces the expression of animal proteins genes. So for the post-developmental loss of structure, attrition, abrasion, erosion, and abfraction. So attrition is a loss of tooth structure caused by tooth-to-tooth contact during occlusion and mastication. So main factors are poor quality or absent enamel, premature contacts, intraoral abrasive erosions, or grinding habits. So for abrasion, pathological loss of tooth structure or restoration secondary to the mechanical action of the external agent. So the common causes are hard toothbrush or with abrasive toothpaste and chewing tobacco. So when tooth wear is accelerated by chewing an abrasive substance, this process is termed as demastication and it exhibits features of abrasion and attrition. So this one is erosion. Loss of tooth structure caused by non-bacterial chemical process, the gradual destruction of surface by the chemical or electrolytic process. So abfraction, it appears as wedge-shaped defects limited to the cervical area of the teeth and may closely resemble cervical abrasion or erosion. So for resorption, destruction of tooth can also occur through resorption, which is accomplished by cells located in the pulp, or internal resorption, or in the periodontal ligament, which is external resorption. So these are the factors associated with external resorption. So for the clinical features, inflammatory resorption is the reabsorbed dentine placed by inflamed granulation tissues. For replacement resorption, portion of the dentinal walls are replaced with bone and or cementum-like material. So, the next is the histopathologic features, in which pulp tissues are vascular and exhibit increased cellularity. Numerous multinucleated dentinoclasts are present adjacent to the dental walls. Inflammatory infiltrate is present. In replacement resorption, the normal pulp tissues are replaced by woven bone that is fused to adjacent dentine. So for the teeth discoloration or the staining, these are the intrinsic and extrinsic factors. So for extrinsic staining, this one, intrinsic staining, this one. So the localized dermosis in eruption are the impaction and ankylosis. So impaction is the teeth that cease to erupt before emergence. Ankylosis is eruption continues after emergence of teeth to compensate the masticatory wear and the growth of the jaws. The cessation of eruption after emergence is termed ankylosis. So for impaction, these one, the factors are overlying cysts or tumors, trauma, reconstructive surgery, thickened overlying bone, and systemic disorders. For ankylosis, disturbances from changes in local metabolism, trauma, injury, irritation, local failure of bone growth, abnormal pressure from the tongue. So for the developmental alterations of teeth, this one here, hypodontia, a lack of development of one or more teeth is referred as hypodontia. Total lack of tooth development is called anodontia, and lack of development for 6 or more teeth is oligodontia. So hyperdontia is the development of increased number of teeth. So there is extra teeth. As you can see, we only have 32 sets of teeth. If there is an excess, it is called hyperdontia. So the additional teeth are referred as supernumerary teeth. So the midline in the supernumerary teeth in the midline is called mesiodens. So the more from the supernumerary teeth, it is a supplemental teeth with normal size and shape, or a rudimentary teeth which has abnormal size and shape. So supernumerary teeth, natal teeth, teeth present in newborns and neonatal which erupt 30 days in life. So when the teeth usually erupt at around 6 months, erupt like it comes out from the gums around 6 months. So if there is teeth erupting at neonatal stage, it is called the neonatal teeth of the supernumerary teeth. So microdontia, when the teeth are physically smaller than normal. Yes. Macrodontia, when the teeth are physically larger than normal. So gemination, it is defined as an attempt of a single tooth bud to divide, and with the resultant formation of the tooth with a bifid crown. So fusion is the fusion of the teeth. It is quite self-explanatory, the union of two normally separated teeth buds. So concrescence is the ones that are joined at the root instead of this one. Instead of the fusion, goes like this. So dens invaginatus, it is the cusp-like elevation of enamel located in the central groove or lingual ridge of the buccal cusp or premolar of molar tooth. This one. So, tarodontism, enlargement of the body and pulp chamber of a multi-rooted tooth with apical displacement of the pulpal bifurcation of the root. Hypercementosis, the non-neoplastic deposition of excessive cementum that is continuous with the normal radicular cementum. So, associated factors of hypercementosis. So, dilaceration, abnormal angulation or bend in root, or less frequently in the crown. Supernumerary roots, like supernumerary teeth, these are roots, extra roots. For example, if a canine normally has only one root, if it has one more root, it will be a supernumerary tooth. But most likely, the teeth that are affected with it are molars or premolars. This is for canine example. So, amelogenesis imperfecta is a complicated group of conditions that demonstrate the developmental alterations in the structure of enamel in the absence of any systemic disease. Yeah. So, hypoplastic amelogenesis imperfecta the basic alteration centers of inadequate deposition of enamel matrix. So, hypomaturation amelogenesis imperfecta, the enamel matrix is laid down properly and begin to mineralize, but there is defect in maturation of enamel crystal structure. Yeah. So, hypocalcified amelogenesis imperfecta, enamel matrix is laid down properly but failed to mineralize properly. Histopathological features, these are not evident in routine preparations because the calcification of the teeth is necessary before processing. All the enamel is lost in it. So for the treatment, the main problems are aesthetics, dental sensitivity, and loss of vertical dimension. So treatment usually crown replacement for dentures, veneers, and other stuff. So for dentogenesis imperfecta, it is a hereditary development disorder of the dentine in the absence of any systemic disease. Yes. So that would be all. Thank you.